Hi, everybody. This is David Nevins for Citybiz List, and welcome to our program today. Our special guest is Elizabeth Wise, and she is the president and CEO of the University of Maryland Upper Chesapeake Health. Elizabeth, welcome to our program today.
Thank you so much for having me on.
So I think you've been in this job, you can correct me if I'm wrong, a year or so, maybe a little bit less. You haven't quite had your first anniversary yet, right?
No, I started January 10th of last year.
Okay, so
a little bit over a year.
So it's just been a little bit over a year. So welcome to Maryland, and I know we're thrilled to have you here. Tell us a little bit about yourself and your long-standing and successful career in healthcare and how you got to University of Maryland Upper Chesapeake.
So originally from New Jersey, in case you didn't pick up on the Jersey accent. I've worked at different health systems. I've worked at different health systems, two of them in New Jersey, one of them in Washington, D.C., in Delaware. And now I'm thrilled, and Pennsylvania, where I came from. I worked for a network called Lehigh Valley Health Network, where I was the president of the North region, which included the Scranton and Poconos market. I, by way of background, started my healthcare career as a junior volunteer, registered nurse, an advanced practice nurse, and then had different leadership roles ranging from director to vice president of service lines, particularly heart and vascular, and then also chief operating and chief nursing officer roles before I started the president position. I came to University of Maryland Upper Chesapeake Health for a couple different reasons. One, I loved the feeling when I walked into the building, the friendliness, the sense of community. It really is friends and neighbors caring for friends and neighbors, and I like to get involved in the community. So Hartford County very much had that feel to it. I love the construction projects that we're doing. That's important to me because it helps to bring additional health care to keep care close to home. I very much enjoyed meeting Dr. Suntha and very much enjoy working with and for him. And I like the services and programs that we offer, not only in the hospital setting, but really across the continuum of care, including a heavy focus on the needs, healthcare needs of the community. So a little bit of a short, long answer to a couple of questions that you had, but I'm thrilled to be here.
That's great, and I know they're thrilled to have you as well. It's just in my observation of healthcare and hospital management over, the last few decades, it's probably a pretty unusual thing that a nurse is the CEO of a hospital. I would guess it's becoming a little more frequent than it once was, but that must give you quite a special feeling. And I'm just going to guess it gives you it's good for the staff too, that they see someone with more than likely a background pretty similar to theirs has made it to the top.
I'd like to think that I offer the best of both worlds. One is that nurses say to me, you know what we're going through, particularly during the pandemic and now, caring for patients. So they have a sense that I've walked in their shoes. Additionally, I have a lot of experience, and I've been very blessed and fortunate in my career that I've had a lot of operational experience and then just a lot of business experience. So I'm able to take a look at, P&Ls, putting together pro formas to bring additional services. So I've been very fortunate and blessed in my career to be able to do that. But particularly, I am most proud of the care that I provide to patients.
Good for you. So I know that at Upper Chesapeake, first of all, again, for any viewers who are not aware, you're the, I think I can fairly say, the premier healthcare facility in Northern Maryland and certainly in Hartford County as well. I know you have a lot going on. So share, you did talk about the projects and so forth. Uh, share with us a kind of a synopsis of what's going on at Upper Chesapeake, the good and the growth and some of the things that have started under your tenure.
Well, they started before I got here too. So I do want to give credit to our prior leadership with Lyle Sheldon. But people may not be aware of this, but the University of Maryland Medical System has invested over $260 million in Hartford County. That's a significant investment in our facilities. And we have 3 different facilities that are undergoing with different timeframes. But I'll start in Bel Air, where we're adding 72 additional beds that sit on top of our Kaufman Cancer Center, which is celebrating its 10-year anniversary. So that'll be a combination of inpatient and short stay observation beds. Also in Bel Air, we have what's called an ambulatory surgery center, where we're able to offer surgery, lower risk, short stay surgical procedures, but also included in that building will also be an ambulatory institute that'll really be focused on hand, spine, and joint care, musculoskeletal orthopedic care. And we are building in Aberdeen that has 2 different components to it that are connected together. One is a medical office building that has different practices, outpatient rehab, wound care, and then connected to it will be something called a freestanding medical facility, or we're calling it the Aberdeen Medical Center, which will be an emergency room with short stay observation beds, and then in and outpatient behavioral health services. So the Aberdeen Medical Center will be done in March. We'll open that up after we open the tower sometime in early next year. And then the Ambulatory Surgery Center will open up sometime later on this year. I say that today, depending on supply chain issues, right? That's the reality that we're dealing with. But 3 significant buildings that will really, again, open up access to healthcare in our community and bring new facilities.
And this is part of the, I think you said 200 plus million dollars that the system has committed to Hartford County.
Absolutely. Yeah, over 260 million.
Mm-hmm. So share with us, Elizabeth, Maryland is unique in terms of its healthcare system, and we don't have for-profit hospitals as many states do. Share with us your concept of the role of a community hospital and how it serves the community. I know you've been quite a bit out and about in Hartford County, listening to people, hearing their thoughts. So what are you telling them about the kind of healthcare that you're going to provide and are able to provide?
So a couple different dimensions to that. One is we do consider ourselves an anchor institution in Hartford County, right? And that has a responsibility associated with it. And by that, I mean a couple different things. One is that based on the Maryland payer system, our role is to take a look at where we deliver care at the lowest cost setting and to help people and keep them healthy and out of the hospital, out of our emergency rooms. So things like, can we offer expand primary care is one of our goals to help keep people healthy, help keep them out of the hospital. The other thing, so it's lowering the total cost of care, but it's also taking a look at what are the healthcare needs of the residents of Hartford County. And so that may be different than other counties. And I'll give you an example. We have a higher prevalence of smoking in our county, about 26% more than other counties in the state of Maryland. So with that comes lung screening that we need to do for lung cancer, having services for thoracic care here in the county. So we really take a look at what are the needs of the Hartford County residents and how we can bring those needs, again, to keep care close to home.
I know everybody gets worked up, let's just say, when there are changes that are occurring to the healthcare system that they've become so familiar with. over the past several decades. But I know you've been really listening to what people in Harford County are saying, and I know you've been responsive to the needs. So just take one more opportunity to talk about how, not just from a cost perspective, but really from a better healthcare perspective, what your goals are for Upper Chesapeake and how it serves Harford County citizens.
Well, I mentioned about access to care, and it really starts with bringing more primary care providers to Harford County, so that they can stay close to home. We can connect them with the services that we offer, but also in addition to primary care, what are the specialists that are needed in our community? We know we need cardiologists. We know we need endocrinologists. So we're always taking a look at where are those access points and how we can connect patients to the care that they need. Additionally, we are very unique in the fact that we have invested heavily in mental health services for our county residents. And you don't always see that in other states that I've worked at or other counties across the state of Maryland. And by that, we offer things like an urgent care for mental health needs, all the way up to and including if someone needs to be hospitalized for behavioral health needs. And by that, we've invested a lot of resources. We don't get paid enough to cover the cost of that care, but we believe it's the right thing to do because our residents need it based on our community health needs assessment.
And so speaking of the community health needs assessment, interestingly, what you said a moment or two ago, that was the first time I heard, and I think to make sure I heard correctly, you said the smoking was 26% or so higher in Harford County than in what compared to let's say the average of the state of Maryland?
Correct, yes.
Yeah. So, and then you talked about mental health care. I just find it fascinating that you're not really quite obviously, you're not taking a cookie cutter approach to what you're doing at Upper Chesapeake. You're really making it very responsive to the particular healthcare needs of that community.
Yeah, I don't know if your viewers or listeners are aware of this, but any hospital that participates or gets money from the government, Medicare or Medicaid dollars, has to do a community health needs assessment. And they have to update it every 3 years. But more importantly, they have to put together a plan to address what the findings were in the plan. This is all publicly reportable information. A viewer could put in any hospital, including Upper Chesapeake Health, and find out what our findings were and what we're doing to address it. But more importantly, we can't do it alone, right? That's where we work with our other nonprofit agencies in the county to address the needs. Something as simple as when a resident calls 911, the ambulance comes to our emergency room. We're able to get the patient out of the ambulance as quickly as possible so we can get the ambulance back out onto the road to respond to 911 calls. We partner with our emergency operations centers and again, other local nonprofits to address the community health needs.
Yeah, it's really quite something, and quite obviously a bit more complicated and interactive perhaps than the average citizen knows. Anything, not that there needs to be, but what else might be on the horizon at Upper Chesapeake? So you've only been there a year. You've got a lot of construction going on. You shared that with us. Any longer term objectives that you have?
Well, really, I would be remiss if I didn't talk about people, right? Healthcare has experienced, a loss of workforce, healthcare workers because of the pandemic. People are either retiring, they're looking at a different career option. So really a lot of my last year was spent on what can we do to bring joy back into the workplace? What can we do to retain the great people that we have, but also to recruit additional people to Upper Chesapeake Health? And so again, it's the partnership of working with University of Maryland, Harford Community College, to really grow the pipeline of workers so that, and about 80% of our workforce lives in Harford and Cecil County. So that's the pool that we draw from. And I really want people to come here and be successful here. I say, you could have a career for life here. Healthcare has a lot of options and opportunities. And we want to be the employer of choice.
No, I mean, that all sounds wonderful. Anything, Elizabeth? We're almost out of time, but anything you want to add? You've shared quite a bit thus far with our audience, but I want to give you an opportunity to add something that I might not have asked you.
I think in addition to the buildings, the people, the access, number one in healthcare is quality and safety. And so, we are really focused on that through a journey called High Reliability, organizational journey, to take a look at where there might be areas that we need to focus on to make sure that we deliver the highest quality care. And so we will continue to do that. And, I want people to know and be assured that they can get great quality and care and a great patient experience at Upper Chesapeake Health.
Well, I think hopefully they now know if they didn't know before. And Elizabeth, I know that you're doing great things there. I know you've only been there a year, and you have also the resources of the really wonderful University of Maryland medical system to work with you. And again, I think I'll certainly just remind our viewers that listen, healthcare workers are really have been on the front lines.
Yes.
These last few years, the pandemic, needless to say, which most people are aware of, caused all kinds of challenges and the increased incidences of mental health care that, again, you've been on the front lines in providing. And then, of course, in your case, you're also in the midst of one of the fastest growing, if not the fastest growing county in Maryland as well. So lots of challenges there for the CEO of a hospital to address. I'm sure you would
I'm
agree.
up to the challenge.
It certainly seems as if you are. Keep up the good work, Elizabeth, and thank you for joining us today.
Thank you so much, and thanks for the time.
It is indeed our pleasure. Our guest has been Elizabeth Wise. She's the president and CEO of the University of Maryland, Upper Chesapeake Health. Elizabeth, again, thank you for your time, and thank you for watching. This is David Nevins for Citybiz List. Hopefully you enjoyed our program.